what active ingredients in cough medicine help treat a symptom of a common cold. According to an article titled Cold Remedies, What Works, What Doesn't, What Can't Hurt on MayoClinic.com, there is no cure for a common cold. There are some remedies that might help ease the symptoms and keep infected from feeling so miserable. Everyone will eventually contract the common cold. We will look at what is in the cough medicine that helps us feel like we can achieve the world without feeling so miserable. To better understand the medications we take, we will explain the differences between name brand and generic brand, medicine age and dosing recommendations, and the active ingredients in the medicine we take. According to the article Name Brand or Generic Medicines in the Tri-County Times newspaper, many consumers are faced with the decisions of buying the name brand or generic brand. There are now hundreds of flashy cold and flu products that all use a handful of cheap ingredients. According to James Hamlin, in an article titled The Cold Medicine Racket, published in The Atlantic in 2014, the difference in price between brand names and generics account for tens of billions of dollars wasted every year by Americans in pharmacies. Researchers have found that more highly educated people are more likely to buy generic medications, concluding that misinformation explains a sizable share of the brand premium for health products, Hamlin. In a frail attempt to address some of the misinformation, the FDA website has a section titled Myths and Facts about Generic Drugs. One myth is that brand name drugs are made in modern manufacturing facilities and generics are often made in substandard facilities, Hamlin. But the FDA counters with the reminder that it won't permit drugs to be in substandard facilities, Hamlin. And to be approved by the FDA, a generic version of a drug must deliver the same amount of active ingredients into your bloodstream in the same amount of time as a brand name drug. The idea is to help everyone find exactly the right medication that suits them well. When we are young, we never think about the medicine we take, we just let our parents give it to us. According to an article on WebMD titled Kids Cold Medicine Guidelines, in 2008, the FDA strongly recommends against giving over-the-counter cough medicines to children who are under the age of 2. Many people ask what the problem with kids' cold medicine is. There is one specific concern that their medicines were not studied in children. Instead, they were all designed for adults, and then these were applied to children. It is not clear that children and adults react the same way to these medications. Another question the article poses is, what are the risks of using cough medicine? As stated on WebMD, experts agree that the risk for from kids' cold and cough medicine are low, but still thousands of children under the age of 12 go to the emergency room after giving cough or cold medicine. Taking too much medicine of any kind can produce serious, dangerous side effects. Accidentally giving a kid too high of a dose can be very easy to do. Parents might decide that it is okay to use 2 different types of brand names at the same time, realizing that they don't have the same ingredients in them or incorrectly measuring a dose. What should we give our kids for a cough or cold? Nothing cures a cold, but the best thing to do is make sure to keep the child hydrated. If the child has a sore throat, use honey, but only if they're older than the age of 1. Also, make sure to call your pediatrician and he or she will recommend which strategy is best for the child. Statistics suggest children under the age of 4 should not use cough medicine unless it is advised by the doctor, according to WebMD. Ever wonder how cold or cough medicine works or what active ingredients relieve the symptoms? According to an article on Patient Info titled Cough Medicines, there is no evidence from research studies that cough medicine actually works. Depending on what the person wants, make sure to read the label. Experts help to thin the mucus and make it easier to cough. Suppressants help cut the number of times you cough, or if the individuals choose medicines that treat a combination of symptoms. These products have more than just one active ingredient. When using cough medicine, we need to be careful with combination medicines. Many over-the-counter treatments have multiple ingredients. As the weather gets colder and sniffles progress into coughs, consumers go to their local pharmacies to pick up over-the-counter medicine. As stated before, we all end up getting unlucky at different times of the year with that icky, nasty cold. But there are factors that we must look for when buying over-the-counter medicine. Whether we are 2 years old to 100 years old, we need to make sure to read the label of any kind of medicine before ingesting in it. And then on this poster, I have picked 2 cough medicines out of hundreds of different types of over-the-counter medications. This is just saying that we need to look at the label on each medicine to make sure that you are treating your symptoms the right way.